All right, so thank you everyone for joining again this morning. This is the Portage County AODA Prevention Coalition meeting. This is our last meeting, or will be our last meeting of 2021. And this morning we do have Scott Rifleman with us. And Scott, for anyone who doesn't know, is the Portage County Medical Examiner. And he is going to be just sharing some insights with us about really the recent spike in overdose that we've been seeing in Portage County. And I know he is allowing time for questions as well. So I am going to stop talking at you and I will hand it over to you, Scott, so you can take it away.
All right, very good. Well, I will just, actually what I'll do is just throw out some statistics that I have before me and discuss those briefly, and then we'll just throw it open for questions and thoughts. I pulled up actually three statistics: 2021, this year's up to date, and 2020s, and then I did a 5-year average just to kind of show what we do over a 5-year average. 2021 has not been a bad year thus far. We'll keep knocking on wood or whatever happens. We've had 2 overdose deaths and 1 pending, which is probably going to come back as an overdose, so we can probably count 3, but has not been a bad year at all. But 2020 was the troubled year, I guess, if you will. That was of course the year of our pandemic. And we had 8 drug overdoses. And I can break those down in a little bit, but there were 8 total drug overdoses. And these are all considered accidental overdoses. We do have overdoses that are suicidal, suicide ideations, and people die from those, but these are just accidental overdoses where the person really did not mean to cause his or her death. And then so in 2020 we had 8, and the busiest was in the second and third quarter of that period, and then it kind of slacked off in the fourth quarter and then continues into 2021. So I guess we're looking at a good trend going on right now, and hopefully that continues for a very long time. But it's been my 10-year experience that we'll just continue to chase our tail on these. And then when you look at the 5-year average, we average 6 drug fatality or drug overdoses a year. So obviously 2020 was slightly higher. Now I kind of favor this by saying, that doesn't sound like a lot of drug deaths in Portage County, but of course it's demographically based, population based. And so, it's a fair number for us. When you go into Marathon County, whose population is considerably higher than us, their trends are very similar, except they have, well into the 30, 40 drug death category. When we break these down, it's kind of interesting. Over my period of time in office, I see the drugs tending to follow cost of what the drug is. And so we see kind of an evolution as we move on from year to year to year, depending on the cost of a particular drug. Right now, what is in favor is methamphetamine and fentanyl. Heroin a bit ago was in favor, and we saw a higher number of heroin deaths. And in 2020, we had 1 heroin death and 2 methamphetamine toxicity deaths. But the other category that I follow is mixed drug toxicity, and that was 5 in 2020. And what that means is that we're seeing a number of drugs that are combined, and that is the methamphetamine and the fentanyl that we see mixed together. And what is happening now is the drug dealers or the producers of these are now using methamphetamine as kind of a median for transferring fentanyl. And so fentanyl deaths are becoming higher and higher. What's happening there is people may or may not know what they're getting. They might be purchasing methamphetamine, which people normally do not die from meth. That is really, it's more of an upper and not an opioid product. Opioids are the ones that really cause the fatal respiratory depression deaths. So what these drug dealers are doing is mixing. The people, the users will depend upon methamphetamine as maybe their drug of choice. What drug dealers are doing now is lacing the methamphetamine with fentanyl to give a bigger boost, a bigger high, and then that makes that product more, people want that product more. So you don't really know what you're getting if you are a meth user, and you might be getting a concoction, a mixed drug toxicity with fentanyl added to it. And people are getting in trouble and dying from that, not really knowing that they are ingesting fentanyl along with the methamphetamine. So that has become a real concern. The heroin is still out there, but it's become more expensive because it was quite popular a year ago. So the more product availability and the more demand there is, the higher the price goes. So that's why it kind of shifted into the methamphetamine and fentanyl product. As far as the opioid, the prescription over-the-counter opioids are concerned, the name is escaping me, but the prescription drugs, the prescription opioids that were out there, we had a real issue with that a few years ago, but physicians and the drug production community, the drug makers, kind of finally figured out that they're being abused and used. So a lot of checks and balances were put into place. So we don't see many prescription drug overdoses as we used to. It's very expensive to get those unless they're stolen or obtained some other way. So we're back into the heroin and the fentanyl and the illicit drugs that are out there. Kind of rambling a little bit, but maybe I can open it up to some questions and we can spin off on a couple of things. But the one point I did want to make, I made a note of it, was what was interesting about the 2020 pandemic year, and the reason we saw a spike, and who knew this, but we saw an increase in drug overdoses, primarily the fentanyl and methamphetamine, in the second and third quarter of 2020. That's when our stimulus money hit us from the federal government. When the stimulus money came through and everybody was receiving, I don't know what it was, $250, $350 more a month, or whatever it was. Suddenly they had more money in their pockets, and those that were addicted users actually used that to purchase more drugs. And even our law enforcement drug officers indicated that they saw a spike in use also during that period of time, just because there was more money available. And who knew? I mean, that's I guess a negative side effect of what the stimulus money created. Also, the other note I had made is with our numbers, they don't appear that high as far as fatalities are concerned, but it was a few years ago, I did a comparison with our local EMS system. And for every drug death that we had, there were 10 people that were turned around by our EMS system. So with the use of Narcan and the ability to turn drug overdoses around, we saw a 10-to-1 ratio of turned around, potentially very, very close in some cases, fatalities that were EMS got to them quick enough and turned them around to one death. So that kind of shows a huge number there that is a problem, of course. And with the other thing that should be mentioned is a lot of these drug dealers now are realizing that Narcan is a wonderful drug, so they also will provide Narcan along with their opioid. So they're providing the antidote along with their product. And we will find that at some of the drug scenes or some of the turnarounds that occur. are when they get together and somebody is always able to stay somewhat sober, I guess, and is able to administer the Narcan. And that has occurred on a number of instances that our EMS community has been involved with. So with that, I will quit rambling and open to any questions, and we'll go from there.
Okay, thanks, Scott. I know I have a couple questions, but I want to see if anyone else has anything that comes to mind right away that they would like to ask. I'll give a moment for that.
I have a question. This may sound dumb. I have no idea. I'm Jessica Herder. I work with the Community Foundation. But why would drug dealers lace meth with fentanyl? Is it cheaper for them, or what's
Yeah, actually, it's the other way around. They will put fentanyl on the methamphetamine to give more of a boost or more of a kick to the drug. A couple of our drug officers had indicated that these drug dealers, if they can show that their product really has a good boost or a good kick to it, the users will come back to them. So it's almost a challenge out there to make your product a little bit more, the drug dealer wants, or the user wants to come back to that particular drug dealer because he's got a phenomenal product. Methamphetamine, they used to, what's happening with meth is it used to be cooked locally. We, over the years, over the number of years that I've been around, there used to be meth houses throughout Portage County and throughout the state. And those have somewhat disappeared. They're not completely gone, but somewhat disappeared because meth is coming out of Mexico now and being made very, very cheap, and coming across our borders and up and being produced in Mexico and coming up here. And then the drug dealers will lace it with the fentanyl for a little bit more of a kick. And by the way, just, we understand where some of these products are coming from. Fentanyl comes out of China primarily, and methamphetamine and heroin comes out of the Mexican areas. And I attended a seminar a couple of years ago on drug abuse issues, and the federal agent who was giving the talk was indicating that because marijuana is becoming legalized throughout the entire United States and a number of states, the Mexican cartels are turning up their marijuana fields and planting poppies, and of course poppy is used to produce heroin. So it's kind of an evolution, I guess, in what's happening with our drug world.
Okay, thank you for that. So my question is, what are the differences in gender? Are you seeing more like men or women overdosing? Or are they older? Are they younger? Do you have that information?
Yeah, I do. Well, given in 2020, there were 8. Well, it doesn't break it down per the drug, but there were 8 overdoses in it. It seems to be more prevalent male. I've got this categorized in all accidental categories. So male seems to be more prevalent than female. And the age group I've been seeing within the last year or two really is the middle-aged population or older population. I've had several that were in their 50s, and a number that were in their 30s and 40s. So saw that more in kind of a middle-aged grouping than much younger. But to be honest, I did not break that statistic down. I'd have to dig deeper into my stats to pull that out. But from what I've been seeing, it's a little bit older population than our high school or college youth, which is probably a good thing if there is one to this.
Yeah, that's interesting. Do you have any ideas like why it is affecting kind of the middle-aged more? Or I guess we have a couple members of law enforcement too, so I don't know if you have any insights into that.
Yeah, I'm not sure if I can specifically speak to why that. Yeah, I don't know. Throw that out. I will say that, you know, a few of these deaths we find to be people that have cleaned up and gotten sober over a few year period, or those that have been incarcerated due to whatever, potentially drugs. And then when someone leaves from being imprisoned or in prison, or suddenly falls off the wagon, if you will, they tend to go back to the original dose that they had taken when they were used to the drug and frequently getting high. And that then, because their tolerance level has changed, we're seeing those that have been incarcerated or cleaned up suddenly die because they will shoot up or take the drug at the level that they had originally, which is now toxic to them because they've been clean for several years. That's a trend we've seen also.
Okay, thank you. Are there any other questions from anyone else? Okay, I'm not hearing anything. Oh, Connie, you can go.
Are we seeing anything in our young people?
Younger people being high school or college age.
Mhm.
No, not a trend that I'm seeing. And as you know, as mentioned, the matter of fact, in 2020, start out at age 21 and greater. I'm not sure if those 21-year-olds, 21 to 30, whether any of those were drug overdoses or not, but there were none in the population below 21, for sure, because there's just no stats for that or no numbers for that. And like I said, I haven't broken this down as to which of these accidental deaths are truly drug related in my age groupings, but definitely nobody younger than 21.
Okay. And I will just make a comment too. So Portage County was awarded funding earlier this year to start an overdose fatality review team. So, and we applied to this funding in response to the fact that, as Scott said, 2020 was a really bad year for overdose. And that was something that we were seeing on a local level. And when we saw that the state was offering funding, we decided to apply in response to that. So actually this afternoon is our team training for that. So after this training takes place, we will be starting those reviews and hopefully just get some more information about, you know, how and where overdose could have been prevented. So I'm excited to see the data that comes from that and just the work that's going to be done with that. So Jessica, I see you asked a number. What was the total number of deaths again for 2020? I believe it was 8, right, Scott?
Correct. Yeah, the total number of drug-related deaths were 8 for 2020.
Thank you. So yeah, I'm excited to see how that grant goes and how our team develops, and I guess what we're able to uncover from that. But definitely it was a really nice way to just get something started, and also support the medical examiner's office as well through that funding. So another question that came through the chat, what was the 5-year average again, Scott?
5-year average, I believe I said 6. Yep, 6 was the 5-year average.
Thank you.
I have one more question. Well, maybe like 2 more questions. You know, you talk about people who, I mean, not that I want to say like the expected people, but do you ever come across overdose deaths in people who were like completely unexpected that weren't already in the scene?
Just thinking off the top of my head, not really. Most of those that we've handled have been known by the system and in the system, and a number of those really had been actually turned around several times by EMS. That's really something, and I guess that kind of flows more into the conversation about intervention. How do we intervene with these people? I mean, if we see these people being turned around by our EMS system 2-3 times, and then suddenly they die from it, where was the intervention in between? And so that's something that certainly can be looked at or thought about. I don't know, Dana, did you have any thoughts with, from your perspective too? I think that's kind of what we're seeing for the most part. You'd be involved with more of the turnarounds too.
No, I totally agree with what you've been saying, Scott. And I think the officers carrying Narcan in their vehicles have been very beneficial, because sometimes we are there prior to EMS and our officers have administered 1 or 2 doses of the Narcan and have saved these people. And you're right, it's reoccurring of overdoses and bringing them back around. And once in a while we have that fatality where it just doesn't help them. And yeah, so it's a tough reoccurring cycle. But I don't know if this group is the place to try and have that intervention, or obviously there's some confidentiality and sharing names of who's overdosing to get them to the right spot. I don't know where that comes in, to be able to have that connection between the situation and need for a treatment.
Right, I agree. And the two things to highlight. First of all, Dana brings up a good point about all the officers now carrying Narcan, which is huge, and oftentimes, or most often, they will get there prior to EMS, and they can begin to administer the antidote. The other thing is our mental health care system, and I also sit amongst on 2 different suicide prevention coalitions. And here again, this conversation comes up often. How do we get intervention for potential suicides or for the chronic drug abuser user? And mental health care is a real issue, and not just in Portage County, but out through the entire state and through the nation, just trying to get adequate health care for these people.
Yeah, last week, Portage House staff was trained in Narcan, which is great. It took a while to get that kind of up and rolling. And they were saying, because they're from Portage County, or from Wood County, that came and trained us from 3 Bridges. And on average, they're having to Narcan people 3 times over there, because we just asked for 2 doses. And they said, so they left us with quite a handful, because they said, yeah, you'll need more than that. But I didn't know this, but there is a hotline out there that this boggles my mind, that if you want to use, but you're fearful that you're going to OD, you can call and somebody will sit on the line with you and talk with you and whatnot. And if you stop responding, they will send EMS or call the police out there. So there's a lot of prevention. I'm going to say prevention. Resources out there for people. It's kind of like the needle exchange, right? Or when people are discharged from jail, giving them Narcan. So it's out there just for harm reduction in a sense. I'm not saying it's treatment, but I guess I didn't realize that was available out there. So I learned a lot from, it was like a 45-minute training. I learned a lot just from some of that.
Scott, you said that our 5-year average was around 6 people. Are you seeing, or are you hearing from like our surrounding counties? Is that pretty similar? Are they seeing different things? Are they seeing kind of similar trends at all?
It's pretty similar, of course, in demographic and population base. So Marathon County has had a huge drug problem, probably, I guess, percentage-wise greater than ours. I'm in contact with Jessica Blonick, the ME up in Marathon County frequently, and they've seen a huge surge. The other interesting demarcation that occurs in the state is a lot of the drugs that are seen in Marathon County, it comes out of the Minneapolis region. What we see here in Portage County comes out of the Chicago region and is actually surprisingly, amazingly filtered through Wisconsin Rapids for some particular reason. So a lot of the drug dealers that are narcotics agents catch up to, they kind of chase towards the Wisconsin Rapids area, whereas in Marathon County, it all comes out of Minneapolis. So it's a weird demarcation that occurs there also. But yeah, it's population based and probably how to properly say this, but maybe homeless based or different demographics than we may have here in Portage County. And of course, Milwaukee and Dane County have huge drug problems. But pretty much statewide, I mean, nationally, it's a huge problem. And costs our community a tremendous amount of money, which we can throw out on the table too. I mean, for my office to investigate one drug death, it ends up to be around $3,000 to $4,000, possibly $5,000 by the time we end up doing a full forensic autopsy and doing the full forensic toxicology, which is required in case we have to go to court with these cases. So it's a huge burden on our taxpayers also. For Portage County alone, multiply our numbers by $3,000-4,000 just for my office alone. That does not include law enforcement and even our mental health and medical system, our EMS system. It's a tremendous burden financially too.
All right, good discussion. I'm just looking at the chat, make sure I didn't miss any questions. I think someone asked Dana if resources are given in the event when Narcan is administered, and Dana, I see you answered and you said no, just because very minimal contact and they're taken to the ER pretty quickly. So thank you for answering that. And I think that's it that came in through the chat. I did put a couple of links in the chat. So the first one is I came across through Your Choice prevention programming. They actually are offering virtual Narcan training, and it's free. And each participant does get a Narcan kit. And even if you're thinking you might not need it or whatever the case may be, it can be used on like pets, little kids, any time that there might be like an accidental overdose. So if you have some heavier drugs or prescription pain pills in the house, it's probably good to have that on hand too, just in case. So I wanted to share that with everyone. And then I also linked the Three Bridges Recovery, which Andrea was talking about, because they do, yes, a lot of work and sounds like do offer the Narcan training. And then I also linked the Never Use Alone website that Andrea mentioned, because yeah, I agree. I just learned about that too a few days ago and I wasn't aware it existed, but definitely some really good resources in there. So check them out. And like I said, with the overdose fatality review team, I'm hoping that we learn even more too and really find out some other good things. So are there any other questions for Scott at this time?
I did have one more question. We had that presentation from that tall cop guy, and a lot of the drugs or dietary supplements, I should say, that he was talking about are things that, from my understanding, don't show up on a toxicology report. So how do you know if you're, like some of the, I don't like Tiana, Kratom, like, are we seeing any of that stuff in any overdose, or can we even tell that yet?
Well, to answer the question on whether toxicology can pick it up, we do a forensic tox. Those are sent to, well, the lab we use is out of Indiana, and that picks up pretty much any substance, foreign substance that's in the body. So basically, if it's a foreign substance, yes, our forensic toxicology will pick that up. Now, to get back to supplements and vitamins and some of these other things used, if it's a natural occurrence in the body, I mean, if it's a vitamin type substance that's being used, no, that wouldn't show, obviously, because it's a normal body substance. I suppose there's a way to measure that, but it's not really followed that much. Personally, have I seen those drugs involved in the scenes that we've been involved with? Maybe Dana can latch onto that too a bit. Am I seeing these involved? No, but generally the drugs that actually kill people are those that are primarily the opioids that cause a respiratory and central nervous system depression. And if these other supplements or dietary supplements, I doubt if they would be hitting that category. But here again, I'm clowning a bit because I just have not seen it.
And I'm not sure on law enforcement and either. I guess, Jessica, did you call it kratom?
Yeah, he was going through a bunch of different stuff like Tiana, kratom were some of the main ones that I took notes and I wrote them down somewhere. I don't know where they are, but there was a few
Sure.
different things. And what he was saying is a lot of this stuff acts just like meth, but it doesn't show up in your system. So like meth users who've used meth in the past will use some of these things, but they can pass a drug test. And so, or so-and-so person A is acting really weird and nobody knows why, but they call them dietary supplements because it's not anything that's approved by the FDA. So it's not like it's a real, but that's how they get around, and they're seeing some of this stuff in like the smoke shops around here. So I was just wondering if.
Okay.
And I was going to say that it's interesting you brought that up because I happened to be filling in for the property officer last week, and I was putting some stuff away. And one thing that I put away was this bag of powder that had kratom listed on it, and I was unfamiliar with it. So,
And actually, so kratom, my understanding is that it's actually illegal in Wisconsin, so that's why you don't see it often, and it's not in our surrounding states. So in his presentation, he was talking about how at the Illinois border, for example, when he was driving up, they had just walls of this kratom, but it's illegal in Wisconsin. But, he touched on Tiana, he touched on the Delta 8, which is, something that's, legal. So it's a lot of these legal substances that are sold within our communities, but mimic the same type of high. What I don't know, kind of Scott, to your point, is does it have the same type of response on like our organs? So, when you're talking about the opioids and how it affects the respiratory system, like, I don't know. So I don't know if some of those responses would be the same if they're using some of these legal substances.
Right. And now as we carry this conversation forward, I now kind of understand what you're referring to and buying this product out of the smoke shops and so forth. I saw, it was probably 2, 3, 4 years ago, we saw that as a real concern, high numbers of these occurring primarily with the EMS system. I've not heard or seen of it since. And I know our drug officers were chasing around to some of these smoke shops. And there was even one in Plover that was out of a convenience store selling it, and I think they were able to stamp that down fairly quick. And I believe, and maybe Gary can fill in if he's still on, we created some county ordinances against the product and some Wisconsin ordinance against the product. But yeah, here again, I didn't see any deaths out of those. We did have one that was a drowning, younger female who drowned in the city, and she had been reportedly using that product prior to her getting in the water and accidentally drowning. But here again, these substances really do not affect the central nervous system and the respiratory system like the opioids do, and those are the, that's the primary deaths that we see. So
Yeah, and I just looked up actually kratom in the drugs of abuse DEA resource guide, and kratom's classified as a stimulant, so it doesn't suppress the respiratory system, at least from what it says in here.
right.
So to answer that question, yeah.
Yeah.
But yeah, really good discussion. How many people in this meeting were able to attend Tall Cop? I think there's a handful of. Okay. Could you share quick what you thought of the event? Or any reflections?
I can go. Yeah, I mean, I thought it was really good. I thought it was excellent. You know, he had a lot of really good information, and, you know, we were there all day, and my attention was captured basically all day from it too. So I think it, again, even if we're not seeing high usage of some of these products, it's still good to know what's going on with some of these products, especially since, you know, working with the youth population, they're always looking for interesting ways to utilize some of these products. So the big thing that we deal with in the schools is the vapes. And so, you know, my questions that day were, well, what can they put in these vapes? What can they utilize? You know what I mean? So a lot of my questions were answered with that. And then just kind of detecting some of that stuff. So I thought it was great. I think it would be helpful to maybe not every year, but every other year, have him come back in and share kind of what they're seeing nationwide, because I think that, you know, like Scott was saying, you know, to the north of us, we've got stuff coming from the cities, and then here in our community, we've got stuff coming from Chicago, and it's good just to know what the trends are around the nation too, because eventually they do end up filtering their way into this community.
I agree with what Jen said. I had actually, I live in Marshfield, even though I'm working in Portage County, and a couple of people from the Wood County Health Department and I had been to a couple smoke shops here in Marshfield 2 days prior to the Tall Cop training, and we saw a lot of the stuff that was mentioned. I mean, it's very easily accessible, it's readily available, and yeah, if people want it, it's around.
I had asked the officers that attended from our agency, because I think we had maybe 5 or 6 that were in attendance, including some of our school resource officers. I got 3 replies back. One said it was very good, wish more people from the schools would have been there, maybe if it was offered during the school year. Also, if it was open to the public for parents of kids. Another one said, I think some of the stash pocket clothing was informational from a law enforcement standpoint. He made a point to schools to develop and have a policy for students under the influence of the legal drugs. Pretty good and worth going to. Nice to get updated. Another one said, thought it was excellent. I would have been nice to see more people there. Some of the other law enforcement agency, better representation from the school district, human services, and community in general.
And I just agree with what was said. I found it very educational. I found he was talking about a group of drugs that I hadn't been looking at before. So it was really interesting, and he's a very good speaker.
Yeah, no, that's good feedback to hear. I'm happy that overall it was very well received. I unfortunately wasn't able to attend that day because I was home with a sick kiddo, but yeah, I have seen him speak before and I agree. I always learn something new, and I think it's a good way to just stay up to date on what's happening, especially since he does an environmental scan prior to the presentation. I think that's really helpful too, because I can't remember who said it, but there is a lot of this stuff in our community. And I mean, if you're not looking for it, you don't know that it's there. So it's good to be up to date with that. So
Yeah, the information he brought back in terms of what he saw when he went into stores, I thought was real enlightening.
yeah, I agree. So yeah, wonderful. So really good discussion. Before we kind of transition into other updates, we have about 20, little under minutes left in this meeting. Are there any other questions for Scott about overdoses or anything about the overdose fatality review team that will be starting up here pretty quick? Okay. Hearing none, and keep in mind, you can always feel free to email me if any questions do come up, or if you have Scott's email, I think you can probably, are you okay with people reaching out to you directly?
Absolutely. Yep, no
Okay.
problem.
Wonderful, and I can always pass along any questions to Scott as well. So, but yeah, thank you, Scott, again, for just the information and the presentation. I think this was eye-opening, and I think definitely I'm happy to hear that things are a little bit slower with overdose this year, but you know, like you said, we'll see what happens and see how those trends continue to go.
Very good. And thank you all for listening to me.
Okay, all right, so like I said, we have about, well, right now we have about 15 minutes left, so we will transition into updates. And at this portion of the meeting, I really just open the floor for anyone to share any updates they might have in regards to substance use prevention, or any reflections you want to share about, you know, something you went to maybe outside of this community that you feel would be beneficial in Portage County. I always save my updates for the end because I do have a few. But whoever would like to go first, you can either type it into the chat or feel free to just speak up. So I'll allow a few moments for that.
I don't really have any updates from the school end of things, just we're gearing up to go. So we'll see how things go the first couple of weeks.
When do classes start in Stevens Point School District again, Jen?
Yep, so the parochial school started today. And then we start next week. We're doing a staggered start. So the first is going to be kind of like our transition grades, so our 4K, 7th, 10th grade, whatever that is. And then the second is when everybody is back at school.
Gotcha. Thank you.
Morning, everyone. Go ahead, Andrea.
Our drug court grant is opened up today. So it's another 5-year cycle. So we'll reapply for that so we can stick with our drug court. Hoping that we can get a part-time recovery coach in our drug court with our funding. We're really pushing for that. And I think a lot of other counties are too. So we're not the only one, but we find that the counties that are utilizing recovery coaches or peer support that is really well, especially when people are getting out of treatment, which I spoke about. That's where we're finding, yeah, we've had a death that way, right when they're getting out or when they need the most support. So we're hoping that'll be a part of our program now.
Cool. Hi, everyone. Troy Seppelt. I'm the Dean of Students for UW Stevens Point, he, him, and his. I talk a lot, so I'll work to be brief. I'm going to drop a couple of quick things into the chat. We have a dedicated Center for Prevention on campus designed to work with students for all 3 of our campuses. So here, Marshfield and Wausau, for AODA and interpersonal violence prevention, and then the intersection of those 2 concerns. So I just dropped a link to the webpage there. And then we, Elizabeth and I have been chatting very briefly on the side A few years ago, we worked with the Stevens Point Police Department to create a thing called Safe Point. And the Stevens Point Police Department did a vast majority of the work with some dedicated funding from the AODA coalition or Portage County specifically for an AODA dollars to pay really for officers to do direct outreach. SPPD officers do direct outreach to the corridors where our students tend to live between campus and town, and where students might gather on a Friday or Saturday evening. So we were just double checking to see if that funding exists. And then we as the university side are refreshing the web page itself. So I have a graphic designer working on doing that. And then we always push and promote the program to our off-campus student populations directly, and then do a little promotion on campus. So trying to be good partners here in Stevens Point with our community. Thanks, everyone. It's nice to see you.
Thanks,
and Elizabeth,
Troy.
I'll give an update as Sheriff Lucas for the drug takebacks. You made up the flyer. I thank you very much. October 18th week will be our drug takeback week. First one that we're basically doing out in the county again in person for about 1.5 years. So I'm sure we'll have quite a bit. So I guess if you can just pass the flyers out to the anybody that's interested. We are posting those and the media already has that and they've been running it. So.
Yep, I'll definitely share that flyer with our email list through our newsletter, just so folks have it and are aware of it. And then I think along those lines too, and Troy, you might have more information on this. I believe the UWSP Police Department is applying to receive a permanent drug Dropbox location, correct? Yeah, yep. So that was an exciting thing. I had talked with Stacy Duhlman about that. And it's nice that we'll have an expanded location for people to dispose of drugs year round as well. So thank you for helping coordinate that.
If you can hear over my son's iPad, I can give you an update. I've got a 4-year-old over here that's trying to keep himself entertained. But Liz Gussie, Youth for Christ Juvenile Justice Ministries, and we've been working in the detention center quite a bit, but we are launching a mentoring program this fall. We want to do whatever we can to keep kids away from these substances, away from the juvenile justice system. So I will put my contact info in the chat. If you are interested in being a mentor, or if you know of a kid who might benefit from a mentor, please let me know and get in contact with me. And I've got referral forms and all of that. So thanks.
Anything else?
Elizabeth, I've got just a quick update. Wayne Sorensen, I'm with the Family Health Center in Marshfield, and representing the Hope Consortium Central Region. So it's a partnership for prevention, treatment, and recovery with providers in Portage, Wood, Clark, and Jackson counties. And we are accepting scholarship applications for the statewide Mental Health and Substance Use Recovery Conference that's going to happen over the course of 3 half days, October 27, 28, 29. I'll put a link to the conference in the chat. I'll also put a link to the scholarship application. It's electronic. And we'll be accepting applications for scholarships up through the 10th of September, and then we'll make decisions. And for those that aren't awarded, we'll still give you enough time to go ahead and consider alternative funding for the conference if you are able to attend. I'd recommend it. It's probably one of the biggest conferences of its type in the state. Lots of content. Will be virtual. And like I said, I will put both the scholarship application. Scholarships are eligibility is for folks that either live or work in the Hope Central Consortium. So that's Portage County. So we'll go ahead and put it in the chat, and would encourage you all to consider attending.